Today, DHAC reporting cases of the Delta variant continue to increase and impact more children than ever before. News 19's Emily Carell has the story.
I want to start today's briefing by highlighting some sobering but important numbers that we're seeing here across the state.
Dr. Jonathan Kanoka is a medical consultant with the state's Department of Health and Environmental Control, who shared COVID-19 data today as it relates to children. He says since August 30th, the 11 to 20 age group has the highest number of new cases in the state. The second highest was the group from birth to 10 years old. He says on the week of June 10th, there were just 173 cases for 11 to 20-year-olds. And of last week, that number has increased to 7,713.
I'd also like to share details from a report this week from South Carolina Children's Hospital Collaborative. Their August 30th report shows that of the 35 kids who were to be hospitalized from complications of COVID, 97% were unvaccinated. That total includes 9 children who are in ICUs and 4 who are currently relying on ventilators to breathe.
Dr. Kanoka says that since the Delta variant is more transmissible than other variants, it is taking a toll on kids, especially those in school who aren't masking.
What we're seeing, I think, across the state right now is in a setting with a highly transmissible Delta variant strain of COVID-19, where children are now congregating in school settings with, some people wearing masks, but, I would say there's probably a large proportion who aren't wearing masks. It's kind of a perfect storm for higher numbers of COVID cases in children. And that leads to, just by the numbers, leads to more children winding up in, in the hospital or in the ICU or on ventilators, as we discussed.
He says that vaccination for everyone eligible is the best way to bring these numbers back down.
Simply put, these routine analyses show the effectiveness of vaccines. And CDC and several other health agencies have credible peer-reviewed studies that show the effectiveness of wearing masks. We've said it before, and we will continue to say it. We can end this pandemic if we increase our vaccination rates. To do that, we need all South Carolinians to do their part in protecting themselves and their loved ones.
I'm Emily Carell, News 19 WLTX.